This tutorial covers the process. It is imperative to understand the process that your practice's team adopts. This tutorial is for both offices that do or do not use the electronic medical records functionality in the system. This tutorial does not teach you how to use all of the functionality or buttons and screens within the system. Those specifics will be covered in follow-on tutorials. In this and virtually all of our tutorials, you'll hear me talk about process relentlessly. An efficient, effective, repeatable business process is the key. For example, when you go to a fast food restaurant, they ask you right up front their key process changing identifier. Is this for here or to go? The answer to that question changes many aspects in the way in which they serve you. In your practice, you want to know, 1. Is this patient coming in with a new episode? Which you will learn the details in follow-on tutorials. An episode is the wrapper around a series of treatments. Basically, is this a new patient or an existing patient with a new problem or insurance company? You will handle new episodes differently than existing ones. Or 2, is this a cash patient or an insurance patient? Basically, can I simply collect cash at time of service, or will I need to create a claim and submit it to the insurance company? If nothing else, remember, it's all about the process. To fully realize the benefits of partnering with Red Pine Services, understanding the concept of business process is fundamental. An efficient, repeatable, consistent set of processes is the cornerstone of using the Red Pine Services system. Keep in mind, this is just the typical process. Your practice can modify the process depending on a variety of circumstances. We are only providing this tutorial to show you how the most common way in which the system is used. It is by no means the only way. For this first example, let's say we have a brand new patient that has come into the office. The front desk staff is generally in charge of adding new patients to the system. Simply click the Add Patient icon here to start the process. We use this screen to easily enter in the primary demographic data in a linear fashion. Your hands need not leave the keyboard to zip down this page. Upon saving, the system automatically takes you to the next step in the process. Add as many insurance payers as you like, along with the coverage info and statement of benefits. After completing the insurance entry, click on the Episodes and Encounters subtab for the next step. Simply add a case, or what we refer to as an episode, for this patient. This is the reason the patient is being seen by the practitioner. It is like a wrapper that will encase a series of encounters or patient visits. Since the front desk staff are generally the first people to see the patient's intake forms, they generally have all the information they need to create the episode. You could also add several other items to the patient record at this point. We'll cover those in future tutorials, but now that we have the patient's basic information ready, we can move on to the next step. The front desk generally schedules the patient and adds a visit type which identifies why the patient is coming in. In this case, we know it's a new patient due to the color, which is totally customizable, and checks them into the office by dragging and dropping them into a waiting room, which automatically pops the check-in process. The front staff can either run through the process now or wait to perform these functions during checkout. If you're going to collect payments during check-in towards a service that has not yet been rendered, do not create the invoice during check-in. You will do that during checkout. Post the payment for that service on account. You will actually apply the payment towards an invoice that is created post-treatment during checkout. This allows you to both create and connect the invoice to the specific visit and encounter, rather than creating a simple document that has no other real value other than to track funds. The front desk staff generally doubles as a chiropractic assistant at this point. They go to the patient care screen to prepare the doctor's documentation. The front desk staff will drag and drop the patient into the Treat Patient box to start the encounter. The front desk staff, or CA at this point, will open the episode for this new patient. Why? Anything the staff can do to reduce the amount of work the doctor does is more time the practitioner will have with the patient. If this was an existing patient, the open episode from the last visit would automatically be here. But this is a new episode, so the staff member selects the blue arrow and selects the episode that they just created when they added the patient. If the practice makes the decision to have the staff document subjective information for the practitioner, they could do it now based on the intake forms. Either way, when the staff member is done and ready to hand this documentation off to the practitioner, they simply save and exit, and move the patient profile to the appropriate room in the queue. This is the key indicator between the staff and the practitioner. This tells the practitioner that the staff has set up the documentation and is ready for the practitioner to finish. The doctor then sees the patient move into the selected room. The color tells them, in this case, that this is a new patient evaluation. The practitioner simply drags the patient into the Start Treatment box to open the selected tool to start the documentation. The doctor can see the name of the episode and how the patient is going to pay for the visit. In this example, it displays MVA. If it is a cash patient, it would say so, and proceed with the initial evaluation documentation. Since this is a new patient evaluation, we will need to go to the Superbill to determine which codes we want to use, after saving first. Since this is a new patient and/or new episode, and an insurance company is going to receive a claim, the practitioner will use the Superbill, code it, and the doctor can determine if they're done documenting and coding, and if they want to have this date of service show up on a work list in the event that they need to finish later. In this example, the practitioner is finished documenting. So they uncheck the box and submit the date of service to billing for claim and/or invoice creation. This is important. This may be an important process change in your office, regardless of whether you want a claim to be sent to an insurance company or if this is a cash patient, you will select Send to Billing for all of your patients. When you are ready to have them charged for the visit, then, to signal the front desk that you are done, drag the patient back into the waiting room. The front desk staff then completes the checkout process. If not completed during check-in, collect copays, process payments, and reschedule the patient. Then select the billing icon here during checkout. Select the Edit button here, below the summary of the billing information that was produced from the documentation. You will notice the Data Service Editor is displayed, allowing you to create the claim and resulting claim invoice directly from the checkout screen. No need to navigate to other screens. If you would like to create an invoice for cash services and products in addition to the claim that is being produced for this visit, simply add them here. To create both the claim and invoice for this patient's visit, you have the option to do so. The invoice automatically pops, and you can apply payments now or monies that you have collected during check-in that were posted on account. Once finished, click Return to Checkout Process at the bottom of the invoice to finish checking the patient out. Had this patient been a cash patient, the Date of Service Editor would have been green, not white, and the invoice for the service and any products would have been created here. Again, apply payment and finish checkout. For an existing patient, a patient that is coming in for a follow-on treatment with an existing episode, the process is a little different, far simpler for the practitioner actually. The front desk still checks the patient in, and then they go to the Patient Care tab. The front desk staff still drag and drop the patient to start the treatment for the practitioner. Notice that the open episode is automatically displayed this time. However, this time the practitioner has past records in the system to use as a template for today. If we just saw this patient 2 days ago, what really changed? Shouldn't we be able to use the last date of service as a template? The staff will select the Import Manager, go to the last date of service for a typical visit, or to a last evaluation for a re-eval. Select the date of service you wish to import, and import selected. Notice that the past selected documentation is effectively a template for today's documentation. The staff then selects the Save and Exit button at the bottom of the screen. And just as for any patient, the signal to the practitioner that the staff is done preparing their documentation is to drag and drop the patient into a treatment room. The practitioner then opens the documentation by redropping the patient into the box. Or select them from the Open Encounters work list, if they prefer. It doesn't matter. Since the staff has already done the setup work for the practitioner can quickly use the last date of service as a template. They can simply adjust any of the data, all from the same screen. Generally, with no need to go back to the full editor nor the Superbill, since that data is now accessible from the screen as well. After determining if they want to put this date of service on the Open Encounters work list, they simply send to billing for claim and/or invoice creation. Signal the staff that you are done by dropping them back into the waiting room. And the staff checks them out as usual. The next part of this tutorial is designed only for practices that are not using the electronic medical records functionality. If you are not using the electronic medical records functionality of the system, it assumes your practitioners are using paper documentation and a paper superbill or routing slip to communicate your coding to the biller. For this example, let's say we have a brand new patient that has come into the office. Just as in the before-mentioned process, the front desk staff generally is in charge of adding new patients into the system, which takes you into the patient information screen. After completing the insurance entry, we recommend that you do not create the episodes just yet. Again, this is for those practices that are documenting on paper. The front desk generally schedules the patient and checks them into the office, which automatically pops the check-in process. The front staff can either run through the process now or wait to perform these functions during checkout. If you would like to use the system to manage the patient flow within your office, drag the patient into the correct room and drag them back into the waiting room or other rooms as appropriate. Since you will want to connect your patient to an encounter in the system, even if you're not documenting within the system, go to the patient care screen, generally during check-in or check-out. Drag the patient into the Start Treatment box. You should open in the Superbill. If this is a new patient or to add a new episode, if not yet added previously, click the Add Episode button here, rather than adding the episode during the Add a Patient process. Once created, you'll notice that your episode is now connected to this date of service. If this patient was an existing patient, one you have seen before, the episode would have already been attached automatically. You only need to add the episode if this is a new patient or new episode. If this is a new patient or new episode, use the Diagnosis Code Manager to add new codes. If this is a new patient or new episode, use the Superbill to code this date of service based on your practice's paper process. Generally, the practitioner will use some sort of routing slip to communicate with their staff. They will generally document the specific codes and units they wish to bill. Or, if this patient has already been in before, use the Import Manager to use a past Superbill as a template to copy the past diagnosis codes and procedure codes for use on today's claim, just as we did earlier when using past documentation forward as a template. Notice that the past codes are effectively a template for today's date of service. Make any changes necessary based on the paper routing slip for today. Note, you can also change the rendering practitioner, the date of service, the system defaults to today's date, or even the visit type. The staff can determine if they are done coding, and if they want to have this date of service show up on a work list. In the event that they need to finish and send a billing later, they will leave the box checked. If you are finished coding and ready to send this Superbill to billing for claim creation, uncheck the box and submit the date of service to billing for claim or invoice creation. The front desk staff then completes the checkout process, including the new billing functionality. And at any time during any of these processes, the billing staff is creating and submitting claims that the practitioner has sent them. You will find that far fewer balls get dropped, because you will develop a systems-based process for your practice that is effective, efficient, and repeatable. And remember, this is just the typical process. Your practice may modify it for a better fit.